Hello, my name is Dr. Randy Chen. I'm a nephrologist who takes care of patients on dialysis at home. Dialysis at home includes peritoneal dialysis and home hemodialysis. Safe and effective treatment is a primary goal when we do dialysis at home, and it takes a team effort. In the following video, you will see patients who talk about how they do effective and safe treatment at home. We hope you learned something from this presentation.
My name is Margaret, and I am a peritoneal dialysis patient for the last 3 years. I have an exercise up in the chest, and I try to make sure that everything is very sterile when I'm doing my treatments. I work out during the evenings, so when I get home I have to make sure that I am making sure that I'm dry, my exit site is clean. Always make sure that my hands are washed whenever I am touching my exit site. Make sure that I hand sanitize. It's very, very important to have yourself very sanitized and cleaned as much as possible.
Hi, my name is Mark, and I've been on the peritoneal dialysis for 6 years, and it's gone pretty well. But about 3 years ago, I did get the peritonitis about 3 different times. And they took out the catheter and let myself heal, and then put it back in. And then since then, I've made sure to be really conscious of how to keep everything clean and not do things really fast, take your time. And since then, I've had no other problems with peritonitis or any other infections.
Hi, my name is Sharon, and I'm the caregiver of my mom, Inez. I've been taking care of her for about 2.5 years from the time that her kidney fell. One of the first step that I do to start her PD at night is to wash my hands, close all the windows, doors, sanitize everything, use my gloves, my mask, then do the setup, which I do clean also with the blue solution, Alcavis, and then from there we started over the clamps, and then doing the connection, cleaning her side for about 5 to 7 minutes. Use the sterilized gas, then tape it, and then also I do the 2 minutes for the transit set it up, and then from there we press go, and she's ready to go for the night.
My name is Mark Davis. I've been on dialysis for about 9 months now. Recently, I've noticed that my blood pressure was trending downward, which is a concern because if my blood pressure gets too low, it will affect my kidney function. So we want to adjust my blood pressure medicine and my dialysis treatment to preserve as much kidney function as possible and hold blood pressure at a good level. And I've been working with my healthcare providers to achieve this.
Hi, I'm Bill. This is my setup. Some of the things I do to make sure everything is clean and sanitized is I kind of organize everything. I have everything in place so that way everything is within reach. So one of the things I do is I have a little pocket where I can put all my supplies that I need on hand at the time. Make sure my machine is plugged in, the modem is working, I have a light that I can kind of view everything more clearly than my normal day-to-day life. So the machine has a menu that walks you through setting up your cartridges, your bags, and you can follow it. I usually do just to make sure that I have everything connected, that I'm using it as my checklist to as an extra precaution to confirm that I have things connected, that I checked the right tubing, and make sure that it's set up for the night before I hook up. Okay, ready? Okay, so this is our dog Taylor. She's she's very playful. When I do my treatments, I usually don't have her in the room, but she does shed, so that is not a good thing for when you're hooking up.
My name is Annette. My dialysis history is I've been on dialysis for 22 years now. First 6 months were in center. Then I did 10 years of peritoneal, and now I'm on my 12th year of home hemo. They always made me feel that it was going to be okay. So I have to give you a little background about me and home hemo. I did not want to do it. I've been doing peritoneal for 10 years. I was really happy with it. It was wonderful. I could do everything by myself. I didn't need a care partner, et cetera, et cetera. And on top of all that, I am extremely needle phobic. So the whole thought of needles was like, I can't do that. That's impossible. No. And there'd be times when I first started going in there that I'd be crying, and they'd all be taking care of me and getting me through the process. So having people around me being that kind of supportive, like, it could have been really possible for people to be a little aggravated with having to deal with the basket case I was being. But they were all wonderful. That was great. Even after I got home, there would be problems. We were trying to do buttonholes, and then we couldn't get the needles in. People came out to my house way more than once to do things for me. I had a nurse drive down from Vallejo on New Year's Day to stick a needle, which is, way above and beyond. But people really, really, really have taken excellent care of me. I had no complaints about staff ever. After a while, it's like riding a bicycle. After a while, it's routine. You know how to do it. It's like in your bones. You could do it in your sleep. The other part is there was always a nurse on call, and there were many times when something would happen in the middle of the night. We'd have to call somebody to get some help with it, and they were always there. Well, yeah, that helps a lot, especially in the beginning when you kind of know what to do, but still it's not like ingrained in here, or you've got to putz around trying to find the sheet of paper that tells you what to do about this, that, or the others. Knowing that there's always someone available. My husband's there, the on-call nurse is there to help with those problems. It just puts your mind totally at ease. I don't worry about anything anymore.
Thank you for joining us today. Hopefully some of the patients were able to give some good advice and tips to stay safe at home when doing your dialysis treatments.